I thought I would do a 2-week post arm lift update. It's been officially 2 weeks since I had the excess skin on my arms removed. Things are healing very, very well. I have gotten the go-ahead to try running, and so I have twice now. It's kind of hard to readjust. Now, of course, my biggest challenge, and I've said this before, they're my legs. The excess skin there hurts. It physically hurts when I'm trying to run. And so trying to push through that pain is something different. Now, was the skin there before all of this plastic surgery? Of course. But here's the thing. I was more balanced, I guess, for the lack of a better explanation. Because I had the excess fat here, or excess skin rather, a little bit fat, it kind of balanced itself, so I had my center of gravity all figured out. Right now, I don't. Everything is pulled down, and so if walking hurts without compression, running is pretty painful. So I'm hopeful that insurance will look at my legs and say, yeah, we could cover taking some of that skin off just to make things easier. I'm realizing that refining my center of gravity and how I'm standing and walking and running is a big change. Something that I did not know that I was going to have to go through. Here's the other thing. Despite the surgery that was done in my arms, I still have a lot of swelling that happens downward. Well, like I said, everything is sucked in and sucked downward. I'm still going to be swelling off and on from the body lift, probably for another 6 months or longer. And it all comes around right here, which is where the actual incision were. And then it kind of goes down to my lower hip / upper thigh area. And that's where it swells. When I run, when I'm exercising, when I eat too much salt, when I eat too much food, I mean, even sometimes, I will swell up, and I can tell. My stomach right now is very hard. I don't even know if you can see it, but it is. And part of the reason is because I had a run this morning, and so the swelling is starting. Well, the reason why is because all of the fat cells and everything were sucked out, and the skin was kind of pulled up. So there's that gap within my skin that has to be filled with something. Now, eventually it'll all shrink down and everything will be nice and normal, I guess, for the lack of a better word. But until then, it's going to be filled with water. So that's what I'm dealing with pretty much daily, especially when it's really humid, and my body will let me know, like, hey, how about you take it easy because I'm swollen up. I felt it really badly when I went for a run a couple of days ago outside and the humidity was really high. And went for a run. I got about 1.25 miles maybe. And then my body was like, how about we walk for a while? So I walked for a little bit and then started to run for a little bit, walk for a little bit, run for a bit. Now you have to remember that a couple of months ago, I was going 3 or 4 miles 3 or 4 times a week. I had my furthest at 6.3 miles, and that was way before the body lift. So it's a big adjustment, and it's hard when the thing that I started to enjoy just hurts. And yes, things take time, and Marla's not good at being patient, but it's just kind of frustrating because I hadn't been a runner for so long, and then I became one, and then it's kind of been like, okay, well, you can't run quite yet. We're still taking time. So I went about 2 miles today. I did not run the whole way. I ran most of it. And so that was a big step forward for me so I get back in the routine. It takes time. I know that. Still pretty good for somebody who wasn't a runner. Even, you know, I guess a year ago I was running, but certainly not 2 years ago. So anyway, that's a process. The arms, I'm still wearing my arm garment, as you can see. I've washed it. I have to wear it when I'm exercising, and that can get a little difficult because I wear a sports bra over it. And so then things are nice and extra tight, which I guess is good. I mean, anyone who's a female and who's kind of experienced the beauty of a sports bra kind of suck everything in. It works great, but it's also a little constrictive too, so it gets a little stinky because it's covered in sweat, so that's why I wash it. The incisions themselves are looking really great. A lot of the bruising that I was having has gone away, so can't really complain. I have a lot of motion. There's a few little twinges, kind of like nerve twinges, that I will get in my arms from time to time. Sleeping on it is kind of still a little tender, but I'm not in any great amount of pain or anything. I haven't even taken Tylenol for the last week, so I figure I'm doing pretty well. And things should be just continuing forward from there. So anyway, that's my update, and I will probably update again at 3 weeks and a month if I can. And as soon as I know about the thigh situation in August, then hopefully I'll have some good news there too. So let us still, some big changes going forward. I'll have to readjust kind of my exercise and running again, but for the most part, I'm feeling great and excited for some future changes. So I'll see you later.